and 4 free tickets to Cedar Point.
Time and Temp brought to you by ShopLevisCommons.com.
Welcome back. Joining me now is Dr. Terry Gibbs. He is from ProMedica, and we OB-GYN. We're
Correct.
talking about a topic close to my heart, menopause. I will say, though, I'm going to admit here, if you're watching, you'll be the only ones to know, but I'm already done with menopause. I had a complete hysterectomy 6 months or so ago. I've never said that on the air. I'm sharing. It's like Oprah, Dr. Gibbs. At any rate. Yeah. So my questions are kind of post-menopause, and I'm very young, just saying. The question is, though, we have all kinds of things that happen to us as women, from pre-menopause to post-menopause, that I don't think we, for the most part, know enough about. So to start, I think sometimes it hits women like a Mack truck.
It does.
And talk about some of the symptoms that you hear that women complain about that I know exist.
Well, first of all, the worst, the thing that people complain about the most is the hot flashes.
Right.
And they're the worst after a hysterectomy.
After a hysterectomy.
And
because you're instant menopause.
Exactly.
Right.
You hit that wall. But most women kind of walk slowly into it. The average age of menopause is 51, when everything shuts down. The number one complaint is hot flashes, but other complaints are mood changes and sleep problems.
Trouble with their sleep?
Yes. And
also,
that relates to the hot
memory
flashes.
fog too.
Well,
or foggy. Like sometimes I mean, I definitely felt there were times where I'm like, wait a minute, what? Now you wonder, is that because you're just getting older, or you're busy? But that does impact women at that time of life.
And it's really, it starts to hit them during the transition into menopause. And a lot of times using hormones to get people through that part really alleviates a lot of that fog issue. It's related also to mood changes. Like, I want to use this knife. So
grumpy.
Yeah. So let's get everybody through that.
Murdery is another symptom. So. But it's easy to say, it's easy to dismiss before you're in it, or if you're around it. It's just menopause. What is your problem? And it is something to take seriously and manage, if you can, successfly. But so what's the first step to managing it?
First of all, about half the people that go through it aren't going to have an issue. And they'll always come and say, what's everybody complaining about?
Right.
But then the people, the other 50%.
People that go, I forgot to eat today.
Yeah. Well, the other 50% are really seriously, please help me.
Right.
And the first thing you want to do is see somebody who knows and does something with it.
Which is your practice for the most part.
Yes.
You do a ton with women who are in this situation.
That's right. And so what we want to do is we want to evaluate what they're having and some of the things that we can do for them that are the healthiest, that are the safest. About 15 years ago, there were some studies that incriminated estrogen as being bad. But we have a lot of great guidelines now.
We have parameters now that work.
Exactly.
That's really important for women to know.
Very important.
Because my mother is, I don't know if she cares if I say her age. But anyway, she's, she was on estrogen, she's older than me, on estrogen, very young though, on, off, on, depending on whatever the current wave was, and she's found she's better. She is now past most of the risk factors, and she really feels good on estrogen, and it's properly managed. Someone my age, though, should I not? That's the question that you kind of sit down with your doctor and ask about. So that's, in terms of hot flashes, estrogen might be helpful.
And there's non-hormonal options, a lot of them today. And there's women who can't use hormones, for instance,
if you've already had breast cancer or you're at high risk of breast cancer.
Exactly.
What do you recommend? Was it black cohosh that people would say? What kind of things do you talk to women about if estrogen is not on the table?
Well, there's the herbal remedies. And there's a number of those. And then there's an FDA-approved medication that's come out now. And interesting, back in the 90s, they used to give breast cancer survivors antidepressants, and they would come in and say, well, my depression's a little bit better, but my hot flashes are gone. And we found that group of medications in very low doses are very effective.
Really?
So it's an interesting find.
Right.
So there's a number of medications like that are prescription meds that can help with hot flashes.
So talk about that. But then you also do, I mean, I've also read if you have flaxseed in your diet, there are certain actual, herbs that are supposed to be helpful.
Right.
It's not like you're going to be cured per se, but you can mitigate some of the things.
Yeah, and really you can start there if you like with the black cohosh, the red clover, some of these. And you need to try those for about 3 months to see if they really work.
That's really important to say too. You can't just have one meal with a little flaxseed, a little salad, flaxseed.
We're done.
Menopause managed.
Yeah.
Not
so some of the other medications that I talked about, this prescription brand, they work a little faster. A couple weeks.
What kind of questions should we ask then of our physician about medication?
Well, if you have a preference and why. If you have a concern, a fear, and why. And what you're willing to do and how bad things are.
Do you have to gain weight in menopause?
No.
Okay, because that is the other bad rap about menopause.
Yes. And one thing that happens at that age, and it's not menopause related as much as it's age related. I know I'm not supposed to say that, but
you're no spring chickadee.
I know. We're talk about it. Right. So it's an age related thing.
Right. The older we get, the harder it gets to.
Well, your metabolism slows down.
Okay.
And so you have to work with that.
You have to work with that.
You have to work with that.
You have to understand that the gauges are different. They're turned to a different setting the older you get.
Everything's been turned down a notch. Yeah. So you got to work.
So it comes together at the same time, and you can easily blame one, but really it's something that men are also dealing with. Everybody's dealing with that slower. You're not burnt. When I'm with my kids and their friends, and they'll say I want to lose a few pounds. All they almost have to do is think about it, and 5 pounds is gone in their 20s.
Over the weekend,
boom, gone.
Right, exactly.
And you get that kind of idea in your 20s that if I just watch it this week, that 5 pounds will be. Those days are over, so you have to really make commitments that are longer term, lifestyle related.
And that's why it's really important to go see, especially when you're approaching menopause, to talk to your doctor about, hey, I'm getting there. What kind of goals should I have to enter this menopause? Where should I be?
Do women, do you find that they ignore it, or they have this feeling that they need to tough it out because they don't understand that, you might be having symptoms that you could have help with? I feel like a lot of women just have to, I guess this is just the way it is.
Well, that's a wonderful question, and that's a great reason to come out and do something like this, because there's so many people that just thought, hey, this is my lot in life, this is how it rolls, I'm a woman, this is what I have to do. And it's not. And it's not. It's not. There's a lot of safe ways of having relief. And a lot of people are very uncomfortable with this. So
Right. Well, like I said, I'm here to make you uncomfortable. No, or comfortable. I don't know. But I'm just saying that I have had a lot of success talking to my doctor. I've had a lot of success changing what I eat, changing how I move, a lot of changing the medications that I'm on. I also I'm on thyroid medication. And you need to make sure that your doctor knows your whole spectrum of, okay, what things are happening. And I've also found that I can handle a little bit of a hot flash. Like every evening, so my doses are kind of low. I'm a little around 7 o'clock at night every night, but it's okay. It's okay. That part is manageable. Previous to that, though, if it's every 10 minutes and you're trying to be at work and it's like, okay, this isn't manageable. How can I fix it?
And you got the bad fog, and just people are desperate. Desperate, especially because most of us at this age, we're at the top of our careers and we're busy and we're in demand for all the things we're doing. We don't have time for this. That's right.
Don't have time, Dr. Gibbs. Okay, so the first thing we want to let people know, though, is you do have a clinic.
Yes, and it's in my office at Flower Hospital.
At the Flower Hospital. So Dr. Gibbs is given this priority. So if you feel like no one is listening, that's the thing. We feel like no one's listening to my problem on this, and so the first thing would be to give you guys a call.
Please. And
you do different seminars too.
Yes, we have a seminar coming up called The Heart of the Matter. I'm a part of this. It's about the heart, but it's I'm talking about hormones and the heart, because that was a big concern in that study I told you about, that hormones actually hurt the heart, and they really don't.
They really don't.
No.
So see, that's really important too, because it's the pseudoscience, and we see it. I'm a news consumer, I'm a news provider, and you know, sometimes you'll see that snippet of a study,
Right.
and that scares you, and you think, well, now, okay, I can't be on this, or, you know, and then the flip side is you'll see a commercial for a medication and think, well, that'll take care of it, and maybe that won't take care of it for you.
Right.
So it's that tiny bit of knowledge is dangerous.
Yeah, it's good to talk to somebody.
Absolutely. All right. Thank you, doctor. And now all of you that are traumatized by my menopause, Confessions of Rebecca Rainier's Menopause. Oh, hey, can you go gray after menopause? Like more?
Yeah.
Okay, because I have a ton of gray hair now all of a sudden, which is cool. So there. Stay with me. When I come back, I'm going to talk about the third most important thing of my day, and that is avocado. I'm in love with it. Why you should be too. Stay with us. Don't go away. Thanks, Dr. Hughes.